afternoon, respected Dean Sir, respected Chairperson, faculty members and fellow participants. My name is Nesha Thakkar and I am a third year MBA student from Nutan Medical College and Research Center, Visnagar. Today I will be presenting a review-based conceptual model on the topic AI-enabled point-of-care technologies for equitable healthcare delivery in resource-limited settings. Before moving forward, I would like to start with a simple thought. Imagine a small rural image in which a hospital is 30 to 40 kilometers away. A person suddenly develops a chest pain, and here early diagnosis itself becomes a challenge. And this is exactly where AI-enabled point-of-care technologies can play a crucial role. So through this presentation, I will briefly discuss how existing AI-based healthcare technologies can help improve accessibility and early disease detection in such settings. Before moving further, I would like to briefly introduce myself. I am currently a third year MBA student and I am actively involved in medical education and student-led initiatives through IMA and IMA MSN Visnagar and MACI SCOMI. I have also received an innovation grant of 1.2 lakh rupees under the SSIP scheme for my project on a portable ECG machine. My primary interest lies in exploring how technology and medicine can be combined to improve healthcare delivery, especially in resource-limited settings. Now coming to the global healthcare challenges. Healthcare inequality remains a major problem worldwide. Several factors contribute to this issue, including shortage of healthcare professionals, limited medical infrastructure, delayed diagnosis, and poor access to specialist care. According to global health reports, nearly half of the global population still lacks access to essential healthcare services. This gap becomes even more significant in rural and underserved areas, so the important question becomes, how can technology help to bridge the gap? One of the most promising tools in modern healthcare is artificial intelligence. AI has the potential to transform healthcare by enabling early disease detection, clinical decision support, automated health monitoring, and remote patient management. When AI is integrated with point-of-care technologies, healthcare services can be brought closer to communities instead of requiring patients to travel long distance to tertiary hospitals. The objectives of this study were mainly three. First, to evaluate the role of AI-enabled point-of-care technologies in improving healthcare accessibility. Second, to analyze their potential in early disease detection. And third, to assess the feasibility of implementing these technologies in resource-limited healthcare settings. This study is primarily a narrative review of published literature including WHO Global Health Reports, peer-reviewed medical journals, digital health research studies. The technologies were evaluated based on parameters such as accessibility, diagnostic accuracy, cost-effectiveness, and implementation feasibility. There are several AI-enabled healthcare technologies that are already being used today. Some examples include AI-assisted ECG systems, which help detect cardiac abnormalities at an early stage. Smart health kiosks or health ATMs, which allow automated health screening. Telemedicine diagnostic platforms enabling remote consultation with doctors. And AI-based multilingual communication systems, which help overcome language barriers between doctor and patients. All these technologies support the concept of decentralized healthcare delivery. One interesting example of such integration is the AI-enabled health ATM. This is essentially a self-service health monitoring system capable of measuring multiple health parameters within minutes. This includes ECG, blood pressure, pulse rate, oxygen saturation, BMI, and body temperature. In addition to diagnostic monitoring, the system can also be integrated with telemedicine platforms, allowing patients to directly consult doctors through video consultation. This helps reduce diagnostic delays, travel burdens, and healthcare costs. For successful implementation in rural communities, a structured deployment strategy is required. This may include conducting a community health survey, installing the health ATM at accessible locations, training local operators or healthcare workers, connecting the system with telemedicine services, continuous monitoring and maintenance. Such system can significantly improve primary healthcare accessibility in rural areas. These technologies offer several advantages. They can improve healthcare accessibility, enable early disease detection, and provide cost-effectiveness health screening. They can also help reduce the burden on tertiary hospitals while promoting preventive healthcare. However, certain challenges must also be considered. These include data privacy concerns, need for regulatory approval, infrastructure limitations, reliability of AI algorithms. Therefore, it is important to remember that AI systems should assist doctors, not replace them. They should be used as a clinical decision support tools under physician supervision. To conclude, AI-enabled point-of-care technologies offer a promising approach to improving healthcare accessibility and early disease detection in resource-limited settings. When implemented with appropriate clinical oversight and ethical considerations, these techniques can help bridge the gap between urban healthcare facilities and underserved communities. In simple terms, technology alone cannot solve healthcare inequality, but technology can bring healthcare closer to people. Thank you for your attention. I would be happy to take any question. Yes, ma'am. In India, especially Gujarat, it is developed but not usable all over Gujarat. In the PSC near the Rajkot, it is already developed. Like I saw presented the model, this one. The model clinics on cloud is already available in Gujarat, but not in so much place. So if it is integrated properly with the AI and telemedicine, it can be used. Ma'am, when I checked the papers regarding it, it shows that it is correct up to 99%. Yes, ma'am.
But I still feel AI is a co-pilot and physician is a pilot. Do you believe it?
Yes, ma'am. I believe that AI is a co-pilot because AI should not replace doctors. It should assist the physicians to fasten the diagnosis timing. बिकॉज अगर हम हमारे इंडिया के स्टीरियोटाइप्स देखते जाए तो लोगों का क्या है कि वो डॉक्टर्स पे ज़्यादा बिलीव करते हैं रेदर देन एआई. बहुत लोग हैं जो इतना बिलीव नहीं करते अभी भी. सो हमें परसेप्शन एक डेवलप करना पड़ेगा मेनली अमंग द रूरल पीपल कि इट इज़ सेफ और फिजिशियन का जो भी कंक्लूजन होता है उसके साथ ही आपका डायग्नोसिस अच्छे से कर सकता है. Yes.
So does that resemble one timeline of US? Okay, like when I was in Ahmedabad, there was an NRA couple early morning, middle age, they were walking around, and there was an accident, motor accident. They called 108 and immediately 108 and reached the hospital. So they said that, oh come on, this is as good as one timeline of America. So the Gujarat is really developing fast. I mean, if we can compare the emergency services of 108 to emergency services of 199 of this, that is what I would like to tell you. Gujarat is very doing well, and in this that develops, no doubt.
Okay, ma'am. Thank you, ma'am.
Sir, you have developed this for the rural area.
Yes, sir.
So my question is that in rural area there is no electricity. So you have to
Yes, sir.
give us that
Sir, second one is like AI generated, but this is the first one. It is already developed and it can run on the battery power bank of 7 days without electricity. Also, it can be used without internet.
So you can modify it for a solar.
Yes, sir, it can be done that.